สวัสดีครับ
สวัสดีครับ
คนไทยนะจ๊ะ
ทำไมมาอยู่นี่วะ
มาทำงานอยู่ที่นี่ครับอาจารย์
ดีไหม
ก็ดีเรื่อยๆดีแต่วันนี้ยุ่งนิดนึงอาจารย์ใช้ผมจะไม่ใช้โปรเดม
Welcome back to all participants. Hope you enjoyed the short break. And we will continue this morning session on the issue of topic challenges. Dr. Hilary Inward, a prominent Deputy Governor of for Administration of Sports Authority of Thailand and holding as the Director of the Doping Control Agency of Thailand, has been a great value to Thailand's national high performance elite athletes and teams attending the Olympic and Paralympic Games, ASEAN Games and SEA Games. Please welcome Dr. Hilary.
First of all, let me express my thanks to the organizing committee for inviting me. Always a pleasure coming here. And also thank you, all of you, for turning up. You just have coffee. I love having my lecture after coffee because, as you have just learned, your brain is now so open. Right? Topic today, doping challenges when treating musculoskeletal injuries. Start with homework. When you go back home, look up what that means. Musculoskeletal injuries. Strange question, but if you start looking into it, you'll find that there is a whole range of injuries described under this heading. Anything from bruises to breakages and, treatment can be as simple as resting all the way to surgery. What we will be concerning ourselves today, because of doping, will be the one in the middle, medication. Okay? So the challenge is, the slide is just to dispel the myth that doctors cannot write properly. That's my handwriting. If you can read it, then, some of us do, not just strictly lines. That's just for the nurses and the pharmacologists. They can't read this kind of writing. Okay, medication. We shall be concentrating on the most common. By no means all of it will be here, but half an hour. I usually take about 2 days on the topic. So today I have half an hour first. Hopefully we'll get something. We have glucocorticosteroids. But GCS is what that is from. One of the most common medicines around the world. It cures almost everything, one way or the other. So, and it's very easily accessible by most countries. You may not know it, but if you go into any pharmacy here, you can pick up that in form of eye drops or cream. And the names are all ending in low already. Painkillers, there's a new development in doping world with painkillers, which I'll let you know in a bit. And then injections, a lot of those. PRP okay, stem cell okay. And of course the injection of glucocorticosteroids, which is very common in top class athletes. Is that still okay? But first, let me clarify what doping is. Borrowed it from dance sport. Just to let you know, dancing is actually a sport. There are 11 points there that constitute a doping violation in sport. So most people will say, oh, if they tested my urine and it's positive, then I have committed a violation. No, there are 10 more. Okay. So quickly going through them, you can have the presence of the substance in your body, whichever way it enters, when it is tested by urine or blood. If it's present, then you are already guilty. Very French. International law usually say you are innocent until proven guilty. Doping control regulation says you are guilty until proven innocent. Okay, so if we find it in you, there. The science of detection is so foolproof that we can say definitely that the substance is inside at the time of testing. Then there is the use of and who uses the medicine. I just got off on get It means that if you are a doctor and you've given country to country is different. Usually it means that you cannot treat athlete anymore, but you can still treat normal patients. In some European country, it means you cannot treat anybody at all for 4 years, which is pretty much the end of your career. Refusing to submit a sample, so if somebody turned up and said they are from anti-doping organization, they have the right to collect your sample, and you said no, not a good time, they ban you for 4 years. Failure to file an athlete whereabouts, this is complicated, but the top class athlete has to give their whereabouts information every 3 months. So where they train, where they go to school or work, where they're traveling to competition, that has to be filed on the system, a very big system. If they fail to do that, then 4 years. Tampering with any process, possession of prohibited substances. So those of you who travel with the team, these days we declare our medication within the setting of a national team 6 months before we go, which is a bit of a pain because you're not only a doctor, you have to be a fortune teller as well, as of what you're going to need when you get there, because you don't know 6 months time who's going to be in jail or what. So usually Thailand takes about half a ton of equipment and medication with us when we go to the Olympics or the Asian Games. Make sure we cover all the bases. Trafficking, so selling it, right? Or actually taking it to a friend, you get caught at custom, 4 years. Administering, that's self-explanatory. Complicity, that means you are involved within the process, you know about it and you didn't stop it. Or prohibited association. You know a coach who's been banned for 4 years and you're still working with that guy. You become complicit, you get banned for 4 years. And the last one is liu, an act by an athlete or other person to discourage or retaliate against reporting to the authority. This is for the higher up people who have the authority to tell you, be quiet. If you choose to go against that order because you see it's not a fair thing to do, he gets banned for 4 years. Okay, so this is doping, available online, so you don't need to, well, there's a need to understand it, but there's no need to remember it, although it's come up in the test from time to time. And these days, if you want to go to a big event, like the IOC organized event, Big Game, Paralympic Games, you need to take a short quiz online to get a certificate for the medical personnel, so doctors, nurses, physiotherapists, and so on, and even the trainers. So might be useful later. There's a thing called prohibited list. So not all medicine are banned in sport. Some are. And there has to be a criteria. This is an international standard. Every single country has to be using the same list. So the list is published by an organization called World Anti-Doping Agency, which is WADA. And the principle is that a substance has to fall within these 3 principles to be declared prohibited. Okay? Number 1, it has to enhance the athlete performance. Straightforward. You're taking an unfair advantage against your fellow athletes. Number 2, poses a threat to athlete health. Number 3, violate the spirit of sport. Number 2 is not really debatable. My first day in medical school, when I was in the UK, my crazy professor said to me, remember this? All drugs are poison with some good side effects. Okay, so you know paracetamol, right? It will destroy your liver, but it will also lessen the fever and take away some ache and pains. That's the side effect. The main purpose of it, because it's come outside of your body, is to destroy your liver. So caution when you're using any drugs at all. So number 2 is a given. Number 3, the spirit of sport. What is it? I again, second homework, go and look it up. It's quite a long-winded, descriptive thing. Basically, why do we do sport? We want to compete, we want to better ourselves, higher, faster, blah, blah, together, as in the IOC. So 2 or 3 of these criteria, then it gets put on the prohibited list. Now, there's a lot of those around. Any use of those or possession of those is an ADRV. And the ADRV is anti-doping rule violations. It's small. It was bigger in my room. The thing about prohibited list is that it's updated yearly. So there are substances that are no longer in use that are taken out. And there are designer drugs that are being made every year that are put in. Which means we have to keep up with the list. Not really a big list, only about 3,000 things you have to remember in it, right? Which is fine. But it's not somebody sitting down or any doctor sitting down and saying, I'm going to put that in. There's a period of consultation for about 6 months of the year. Then the expert, they all sit down, gather all the information and then decide. The list for next year will come out around September or October and will be effective on the 1st of January next year. So, if you're really involved and you have an experience of your athlete needing to use drugs, and in Asia we have this problem because we have herbal medicine, alternative medicine. In order to help you and the athlete, you have a chance of actually giving the information to our expert so that the list will be improved each year, right? Within that list, there are structures of types of medication or substances that are banned. Section 1 is substances that are banned the whole time. Before I say that, I need to tell you what the period is divided into. One is in competition, the other one is out of competition. Seem obvious? It isn't. I will give you the example of the Olympic Games. Their in competition period is the day the Olympic Village opens, not the opening ceremony, the day it opens until the closing ceremony. That's their in competition period for the Olympic Games. Which means the other almost 4 years is all out competition. The Asian Games is 2 days before the opening ceremony until the end. In FIFA, 24 hours before the match. That's the in competition. Right? So you need to know your sport and where the in competition is because the list of substances that they test for in the urine are very different in and out of competition due to the fact that they have no need to test some of these, the section 2 substances and method out of competition, saves some money because it's banned only in competition. Okay, so section 1, banned the whole time you are an athlete or an entourage, people who follow them around, including managers and so on. Examples such as anabolic steroids, growth hormone, the whole time. Okay? Section 2, in competition only. Usually these are substances that stay in your body for a very short period. Things like stimulants, it's only 1 day. That's why you have to keep taking it every day. Right? These things are banned only in competition. And we see glucocorticosteroids is in competition only. Section 3 is for some sport, they ban a certain drug, like beta blocker in the sport where you need some focus, like snooker and billiards. So basically beta blocker is something you take and your heart rate go very low and steady. So you're supposed to have better focus. No point in repeated that, but if you're playing snooker snooker or you're shooting, that helps. Then they become a performance enhancer and event. Alcohol in all the races, like Formula One, if you take alcohol and you're trying to go with those, nasty thing happens, so they banned that too. And the new one is S0, right? Since the new code came out in 2005. S0 is any substance at all which has not been approved by your FDA anywhere in the world. There's a big debate going on whether all herbal medicine is S0 or not. We in Asia have just said no, it isn't, because we regulate them now, or at least some of us do. And there are thousands of medications awaiting approval by the FDA. If any of those are found within your body, because they haven't been proven on those 3 points yet, they are considered prohibited substance for now. Okay? Especially for the health thing. Because if they haven't been approved, chances are they have 50% chance of curing you and the other 50 is of killing you. Okay, so S0 is new. Now, specified and non-specified substance. Specified substance is like you can take it in because it can contaminate some food, especially supplement. So you have a chance of saying, oh no, I didn't know about it. Nobody believes you, but you have a chance of saying it. And non-specified substances are something you take purely on purpose. Very confusing. Read it later. It took me like 3 weeks to understand what the hell it is. And they keep changing it all the time. But for the sake of legality, when you go to trial or the result management process of anti-doping, they put this in. And remember, you're not talking to medical personnel in anti-doping, you're talking to lawyers. There's like 2-3 doctors in WADA and 40 lawyers. Now, there's another program called monitoring program. And up until the 1st of January this year, tramadol, which is commonly used in musculoskeletal injury treatment, has not been included in the list. But since 1st of January, evidence has suggested that people who use tramadol, and it's a very convoluted way of saying it, recover faster, and so they can train harder than normal people. So now tramadol is banned, which is weird because it's one of the most effective drugs in our arsenal of medicine to treat pain. Now, there are places you can go to look this up. I would suggest that the first place you go to is WADA, which for some strange reason is www.wada-ama.org. All the information will be there. There are also online courses you can take specifically on this particular matter. You just have to register yourself. The system is called ADEL, A-D-E-L, so anti-doping e-learning system. And you don't have to do the whole thing. It takes about 6 months. You just go in on the question that you have within your team when you look after the athlete. However, if you have a specific case, there's an email that you can go to, info, blah, blah, blah. Or in Brunei, you have something called NADO, National Anti-Doping Organization, which is somewhere around here. You can also contact, they should have all the information there for you. The principle of strict liability, which is what I touched on before. Once we find the substance within the body of your athlete, that person becomes totally liable to being sanctioned. No need to ask how. It's there. But what they can do is to try and explain that it wasn't intentional, it was contaminated, it was in the supplement, somebody gave it to them or whatever. But all those things mean they are referring the responsibility to the team, right? No doctor gave me that. My physio suggested that. My trainer asked me to take that. All of those people would then be sanctioned for 4 years. Which, if that is your only job, would be difficult. And coming back from those 4 years sanction would be, at the moment, almost impossible. Because nobody wants to have anything to do with you. You know it's okay. So that's why you have to understand and follow up on your knowledge the whole time. Now, quick thing on nutrition. The supplements. Consensus by the IOC is that in youth, athlete, never use supplement. Unless you are treating some specific disease. Okay? So we have a discussion on very slow growing child, whether we should treat with food or supplement and all that. No. If it's slow growing, it becomes a disease, get in touch with a doctor. If you need growth hormone, we do growth hormone. Supplement doesn't work. More importantly, if you ask your athlete to take supplement, it's a reflection on how good you are. As a coach, as a trainer, as a doctor. Because the principle of food first. So the first 2 lectures already touch on this. You should be able to give them enough fuel to perform their daily tasks, be it competition or training, right? And the problem is the supplement, 70% of the supplement which are freely available have some kind of prohibited system in them. So if a supplement said you can lose weight, you can be sure it has diuretics. If it said it will increase your muscle bulk, it has steroids. Otherwise it won't work. Okay? There's a thing called batch test. If you need to use it, you can ask the manufacturer to test every batch that they send to you. But that is like testing 1% of 100% of a product. The chance of them missing the prohibited substance is too great for elite athlete. So, glucocorticosteroid, these are the risks if you're using it, which is quite a lot, read it later. But you see osteoporosis, lack of bones and so on, so long-term effect. What you need to know if you want to use it, because it's only in competition that it is banned, is the washout period. And if you see the washout period of triamcinolone, which is the most commonly used drug in this category, is 60 days. So if the guy is injured or he has a pain 60 days before you can try and use it, fine. But remember that each of you, this is an average. It could be 90 days. So there's a risk already, okay? No need to remember it. It's freely available on the website. Throwing this in because the herbal stuff, people are very worried about it. As an expert, my country produces more of this stuff than anybody else. If it's in the food, if you're just eating it when they cook it in the food, you will not exceed the limit. If you smoke it, you will definitely be, right? If you eat it intentionally, you will definitely be over the limit. So there's no need to worry about going to a restaurant and eating it. If we find it and it's under 150 nanograms per liter, you're fine. Okay? Otherwise, you're going to have to be so careful and eat at home all the time, which in Brunei would be a tragedy. Anyway, second thing you need to know is that it doesn't really work in sport at all. At all. Okay? There are better medication substances than this stuff. Third thing is they ban THC, but not CBD. Those are the 2 types of oil. But you cannot produce CBD without having some contamination of THC. So avoid like a plague, enjoy your food. Then TUE, therapeutic use exemption. We touch on medication. So we're not that cruel. If you need to use it, what happens? There are athletes who will be improved very quickly and their quality of life will be good if you give them an injection of glucocorticosteroid. What do? You apply for one of these, TUE, therapeutic use exemption. But you can only apply for it if you fulfill these criteria. One, it doesn't enhance performance. Two, there's no alternative. Right? Three, nothing to do with health. Okay, it's a standard procedure. And four, you're not treating a side effect from other prohibited substances. An example again of hypertension. First line drug used to be diuretic and propranolol or beta blocker. That's no longer true. It's now ACE inhibitor. But those two used to be given for hypertension in athletes. But there are 300 other alternatives, so you never get granted TUE. So you have to treat them with everything else first, and if it doesn't work, then this. This topic alone takes about 2 days. And again, if you want to hear about this in depth, there's a workshop in Kota Kinabalu in 2 days' time. All right. Your national anti-doping agency can grant the TUE, your international federation can, depending on where you're going. But the point about the TUE is you have to do this. If you're an athlete and you went to the doctor and they want to give you medication, it is your responsibility to tell the doctor that you are an athlete or you are associated with an athlete. They will fill in the form or check in the prohibited list first, right? If it's prohibited or not. If it's not, carry on. If it is, then you need to fill in the form, and this form has to be filled in by both the athlete and the doctors. Send it off to the authority. Look it up online who you need to send it to because each sport is different. And there will be a committee who will review this and either approve it or reject it. The thing you need to remember is that there is a thing called retroactive TUE. So you can use the prohibited substance or method in emergency. Then ask for TUE later. Only in that circumstances. Otherwise, you need to get the TUE first. And for something like asthma, you need to get it 30 days before you go to the competition, at least. Because those tough things are actually prohibited. They are stimulants. So, take home message. One, know about the prohibited list and keep up with it. Number two, think before you treat. Is it prohibited? Oh, hang on, I forgot this one. Global DRO. This one, I want you to take your phone, type www.globaldro.com in now. Are you in? Follow the instruction. All you have to do is, after you accept the thing, 5 countries like US, UK, Japan, Australia, I can't remember the other one, they got together and they put in all the substances that are on the list for you to check in real time whether it is allowed or not. In and out competition, even the route of administration is the tool you will use very often if you're a doctor. If you're a sport doctor, you remember it after the second or third time. But when you go to a GP and he said, I'm not sure if this is or not, tell him to go there. That database is updated very often. Right? And you can put in the substance or the name of the drug. There's a trade name and the substance. Like Panadol is paracetamol. Or was it Tramol? Okay. Is it prohibited? When is it prohibited? In our competition, basically. And do you need the TUE? Now, glucocorticosteroids is prohibited in competition if you take it orally or injection. But if you use the cream, it's not prohibited. You see, it gets complicated that way. So this is where global draw comes in. There's a thing called risk to benefit ratio in medicine. We took an oath to say do no harm. If we are going to treat somebody, we always have to think about the risk and the benefit. Now in this case, it means if I use this prohibited substance, am I going to get the benefit for the athlete? So if you have 2 weeks to go to the competition and you said, I need to inject this guy, will he heal enough to compete at the normal level? If he isn't going to heal that fast, why risk him being caught for doping? Right? Which means you have to take care of the guy in other ways. Physio, food, rest, whatever. And then the whole plan of the year changes. Okay? Athlete health, because we are in that industry of looking after them, always come first. If in doubt, their health comes first. For instance, there's a ban on IV fluid. More than 50 or 100 ml within 12 hours is doping violation. But if he is suffering from severe dehydration, from whatever, diarrhea, whatever, you don't wait to call somebody up and get approval. You give him the IV fluid. You justify it with the medical history, test, whatever. No TUE committee in the world will say, no, that is a violation. Okay? So the health comes first, but you need to know about it. Is that it? Right on time. Okay, do we take questions now?
Yes, Dr. Ulrich.
Oh, we have time. Let's go.
Yeah.
Time permitting.
You have 5 minutes.
If we have any questions from the audience.
Normally there isn't any because either I am very good at this or nobody understands a word I say.
But everybody had coffee, so I think they're up.
Yeah, so, yes.
Hello, my name is Rosaimi again. I'm sure there's a direct approach, like manipulations by individual athletes that would like to enhance their performance. Or also, it could be indirect approach, like influence through the social media. So I'm sure the victim could be the youth, and not even just an adult like me. So we are not really sure about the prohibited substances. So my question is there any basic or simple way or strategy to educate about this subject to the youth and young athletes in order to protect them from taking in such prohibited substances from the 3,000 substances that you have been mentioning?
There are probably more. My approach is this. I liken it to smoking. You know how long that the campaign took for them to not start smoking? It's about 30 years. We believe that education is key, and we believe that to tell somebody not to cheat also is a moral obligation. So the earlier you can start, the 3 points, right? It will affect your health when you grow up. It will enhance your performance, but that means you are cheating. And it is against spirit of sport, which, by the way, is supposed to improve your society. So the plan is to have anti-doping education as early as possible. But not to go in and tell the kids who is in like second year of primary school, there are 3,000 substances. What we say is that we call it value-based. So don't even try it because it's bad for you. You shouldn't cheat at all because it's not fair on others. You live in a society where everyone should be equal, right? So value-based education is where you start, basically. But it's backed up by a very sound scientific knowledge. Next.
Anyone else? If we can just take one last question.
I, of course, shall be around to take more questions in the hotel, the coldest hotel I have ever been in.
If there is no question, may I ask something about oral glucocorticosteroid with the APAS observed? Is it permitted? You mean
It's a paste, right?
The paste.
Yeah,
The oral paste.
It is permitted, but these days medications are so good, they get into your bloodstream very quickly.
Mm-hmm.
You have to look at the oral paste. If it's a proper one, it will take like 3 days to wash out. In Thailand, we always ask the physician to record it. And if they find it in the urine sample, they get the retroactive EUE.
We just have one last quick question from our colleague from AFSL, Dr. Bilal.
Now, the injectable corticosteroids, in case of severe pain during competition, would this allow for a retroactive, for example, TUE? That's a question I always get asked.
At the moment, no.
So pain wouldn't.
As it stands at the moment, because the new law rules is that it's banned in competition, you can't even inject it. And you can't even carry the thing in competition in your medical kit because, of possession is third or fourth anti-doping rule violation. And most games are now no needle policy, which means if you want to do it, you're going to have to go to the polyclinic and tell everybody you are going to do it, and they will get you out of the village within 24 hours. It's the next stage of debate, because we believe that the risk to benefit within competition is not worth it. It takes like 72 hours to be fully effective, right? So even if you want to do it today and they have a competition tomorrow, it doesn't work, and it's against the rules. So nobody will give you a retroactive TUE.
Okay, I think that's it, and then we can move on to the next lecture. Thank you, Dr.
Thank you.
Thank you, Dr. Fleury. Next presentation of the Certificate of Appreciation will be presented by Professor Min Hao.
Oral paste is a problem because before that you can use it in the mouth. But now you have APAS also. And if you want to use it, you cannot use it.
You cannot use it?
And also the Paris tendon.
Right.
No, not now. You cannot. In competition.
Thank you both, Professor Min Hao and Dr. Hilary Inwood. And now I'd like to invite your next speaker, Dr. Adrian Lim, who is an UK NHS experienced sports and exercise medicine consultant. Recently, Dr. Adrian Lim has returned to Brunei to strengthen the sports medicine department and currently heads the sports and exercise medicine department at the Ministry of Health in Brunei Darussalam. Welcome to the stage, Dr. Adrian Lim from Brunei.
Very good morning, Pikiran SUT, distinguished guests, colleagues. I see a lot of you here, and fellow Bruneians. It's a privilege to speak here with such esteemed guests, professors. Thank you very much, Dr. Esam, for the opportunity. The purpose of my talk today is to give a bit of context into what we're all talking about. To our fellow visitors, but also the Bruneians, those who are interested and passionate in sport, but perhaps have not had the opportunity to do so. And also I recognize a few faces, but there are a lot of faces here who I don't really know, not familiar with. So we're hoping that by talking a bit about what is available and what we're doing now in Brunei, there is opportunity for you to get involved and come and see me, okay? There is a lot of opportunities. And what you will see later on, I'll be talking about the future in Brunei. So just a bit of an overview of what we're going to talk about, a bit of a background into the origins of sports medicine. I can't claim to be an expert in the origins, but there is some formal documentation. The main departments which run sports medicine services in Brunei at the moment, what services are currently running? Dr. Esam mentioned an important thing about sports medicine in Brunei is accessibility. How many of you have access or know about the access to the 5 doctors in Brunei? Okay, there may be a bit more in private practice that we're not aware of even. Okay, and then the challenges, the global challenges to sports medicine as a specialty, and the local unique ones, and then the future. Okay, don't know if you can all see this. Dr. Esam actually gave me this slide. I don't know if you recognize Dr. Esam in this slide, a very young example. Now this is an article in 1989, okay? Way back in 1989, the Sports Medicine Research Center was formed. And if you look here, they had a 2-day conference in Bandar Seri Begawan with top professors from International Federation of Sports Medicine. And wow, that was 35 years ago, and we're doing the same thing again today. So well done, Dr. Esam, and congratulations. Thank you for paving the way for Brunei in sports medicine. Up to this day, this Sports Medicine Research Center, run by the Ministry of Culture, Youth and Sports, is running. And over the years, the athletes in Brunei have benefited greatly, and also selected a few, the public, okay? It's evolved over the years, and currently there are a variety of services, not just sports and exercise medicine consultations and the physiotherapists. We have the sports scientists, who you all know do regular fitness tests. Right now they're venturing into monitoring load in more sophisticated detail. We have strength and conditioning services. We are venturing into biomechanics, mainly in runners. We have a sports nutritionist, sports psychology, and a welfare department to look after the holistic needs of the athletes. If I use we during this talk, please understand that it also involves sports medicine in the Ministry of Sports, and it involves sports medicine in the Ministry of Health. Because it's a small community and we often work close together, okay? So when I say we, it's not just me. Now, the introduction mentioned I came back. I trained in the UK, came back at the second COVID in Brunei, and at the start of the second wave of COVID. But we only managed to start a sports and exercise medicine department under the Ministry of Health in 2022. Okay, so now this is different from SMRC. This is under the Ministry of Health. And their mission, our mission, is to enable the population to be physically active and to use exercise as a tool to prevent and treat chronic disease, as well as to optimize the health and performance of Brunei athletes. We currently operate in 2 sites, all right? There's a community clinic, that's a flat at Anggrek Desa, very generously given to us by the Ministry of Culture, Youth and Sports to use. So we use this as a community clinic where we see consultations and do some basic treatments. And we also operate 2 days a week at the specialist center. This is a private hospital in Brunei, Pantai Jerodong Specialist Center. Okay, so we operate on 2 sites. And at the specialist center, we have access to facilities such as diagnostics, MRI, and treatments such as platelet-rich plasma and such. Just to note, a key difference also is we are a secondary referral service, so we are not about walk-ins. We accept referrals within the health setting. So our main referrals currently are from accident and emergency from the main hospital in Brunei, Ribas, orthopedic department, physiotherapy, and the community, which is the GP services. In 2022, in our first year, we saw 432 patients in total, And the bulk of them are ankle sprains and knees. They're very common. And in 2023, we started rolling out a systematic exercise prescription service. So you'll notice that the bulk of our patients in 2023 were the ones where we had to do exercise prescription. Okay, and these are the ones who we did prescriptions on for obese patients, the majority. And again, you'll see very commonly what we see are injuries of the knee and ankle. And you can see what's creeping up is arthritis. Okay, arthritis. You may question, is that really a sports injury? But if it's inhibiting them from doing sports, we would see them. Okay, so those are relevant too. So in terms of sports medicine services available throughout the country, and I don't just mean a Ministry of Health, I mean SMRC, and I also mean the private practice. Okay, we obviously have the sports medicine services for athletes through the SMRC, which includes performance optimization. We have sports injuries and illnesses consultations that's available throughout all 3 departments. Okay, and we have a variety of treatments available. Okay, and that can range from things like PRP, which is platelet-rich plasma treatment, viscous supplementation. In Brunei, we tend to use Synvis more. And we do have shockwave therapy, which is strong ultrasound waves to treat tendinopathies. And hydrotherapy and reformers using our specialist clinic. Okay, other services available include this exercise prescription service that we currently offer. Okay. Now, what is exercise prescription? For those of you who don't know, it's a way to use exercise as a medicine to treat chronic disease. We're currently working in partnership with the Obesity Clinic in Ripas to use exercise as a tool to lose weight. So you know there are various drugs that they prescribe. We are in charge of prescribing the right exercises for these group of patients. Okay? And we use the American College of Sports Medicine screening algorithm, because you can imagine obese patients will have a lot of comorbidities. We use this algorithm to make sure that they are safe to embark on their exercise journey. And we use the standard format, which many of you are familiar with. Okay, we use the FIT principle, that we make sure that we incorporate the frequency of exercise, the intensity, using heart rate mainly, time, and the type of exercise. So, for example, for obese patients, we would normally prescribe low impact, because a lot of them will have knee pain, low impact, low to moderate intensity, long duration cardio workouts. Okay? So that's the service that we're currently doing. It's actually available to other comorbidities, not just obesity, but we're working with the obesity clinic right now to do so. We also have a supervised exercise class at Pantai Jurilo. This is once a week. It's a 12-week program. And the purpose of this is really to bring the intervention closer to the people. This is more suitable for people who are not familiar with the gym, who are shy, or we have identified barriers that they don't want to go and exercise to go to the gym. So what do? We write a letter to their work saying they need to attend this 12-week class, and they get permission to come and do so. Okay? And over there, we make it fun, we make it engaging, we make it exciting, and then we can confidently monitor their adherence to exercise and their intensity and the duration. Another thing that we rolled out recently, and we're working with the vascular clinic at the main hospital again in Ripas, is an intermittent claudication program. This is a program for people with peripheral vascular disease of the lower limb. Okay? They have atherosclerosis of the arteries, and it inhibits their blood supply to the limbs, and they get pain when they walk. Now, a recent review, for many of you who don't know, showed that there is high quality evidence for a supervised exercise program to improve their walking distance. We do this because we are able to do this at the Pantai Jurilo, where we have 2 to 3 sessions supervised on a treadmill. Okay? And the aim is to improve their walking tolerance and function and quality of life. Okay, so apart from these services that are out there, okay, we also have been very active working with the various agencies in Brunei to promote exercise. Some of you were there when we gave this talk in 2022. We were involved with coming up with the National Physical Activity Guidelines for Brunei Darussalam. For those of you who are foreign visitors, you will actually notice that this is quite familiar. There's no big difference between the WHO physical activity guidelines. It's half an hour, moderate intensity, 5 days a week. And if you're a child, it's 1 hour every day. Okay? So the thing which has been updated, and actually Brunei did publish one 10 years ago, but the thing which has been updated, similar to the WHO guidelines, is to minimize sedentary time. Okay, so unfortunately what you're doing here all today is counteractive of what we're trying to say, but it's to limit sedentary time, okay, alongside the physical activity guidelines. So we're currently in the process of disseminating this to the health professionals, and we're going to move on to the next agency like Ministry of Education soon. Just for our foreign visitors and for those of you who don't know in Brunei, we are not very good at monitoring physical activity. That's something that we need to improve on. I think the last solid data that we had was 2015-2016. It was from a STEP survey, which is just a household questionnaire, okay? And I think it actually produced quite good data. If you look at it, only 17.5% of men are not active enough for good health, only 33% of women, and overall 25.3%. If you ask me, this looks quite good, right? But I tell you, the amount of patients that we see in clinic, this is not reality. I think clinicians will know. And a separate survey actually showed that 88.5% of adolescents in Brunei were physically inactive. Adolescents. And this was from a school survey, and that's quite alarming, and it's quite a big warning sign for things to come. Okay? So, anyone here from Ministry of Education? Okay, you don't have to put your hand up, it's fine. Okay, let's move on, yeah, okay. Another initiative that we're doing is working with associations, such as Football Association Brunei, okay, to improve player safety, okay. So one of the initiatives that we did last year was to help roll out mandatory player screenings, medicals, for all players over the age of 35. This is just a basic examination, basic history, and an ECG. Okay, and Dr. Esam also was involved with this. We're trying to ensure that each competition venue has a working AED that is checked before kickoff. And we're also working with them to make sure that each club has someone trained in basic life support. So these are all the initiatives that are going on in Brunei. All right, there's plenty of opportunity to get involved. Now, if you're a doctor, okay, practicing in Brunei, yes, it is possible to get trained, higher specialty training in sports and exercise medicine. And we've reached an agreement with Singapore to use their 3-year higher specialty training program. Okay, so I think if you are interested, I think you would need to be working in one of the ministries in Brunei, mainly Ministry of Health, or under my department, and then we can kind of talk through things and go through a committee. So for those of you who are interested, it is available locally to go through this training program. Talking about challenges to sports and exercise medicine, all right? I think we all face this. Some of the challenges that we face are we face in common, if it's Dubai or from Thailand and everything like that. This was a recent editorial in 2023 where it talks about where it got information from 25 separate blogs across the world. Okay, what are the challenges for us as a discipline? It's summarized on this slide here. I think there is this perception on the top left about sports medicine just only being about sports, okay? Whereas in reality, it has influences ranging from an individual own performance or health status to a national team's victory or public health status. People have this perception that we're just dealing with athletes, when actually it's also about the exercise and how we can impact the population health. And you will see in various countries, some call it sports medicine, but other countries would include exercise sports and exercise medicine. So that's a real challenge to raise the awareness that it's not just sports injuries. I get asked this question a lot, even by clinicians in RIPAS. What is sports medicine? And you always have to have this 1 hour talk to talk about the benefits of exercise and how we can use it in the healthcare setting. So that's one of the challenges. Second, education. When I went through medical school, graduated 2007, I was not taught about. I didn't have a module on exercise medicine. And I don't think it's in most university, it's not within the most universities' curriculum, not in UBD as well. So the challenge there is to really get it into the university curriculum so that from a young age, medical students, they will understand the importance of sports and exercise medicine. Policies, we're very lucky that in Brunei, the Ministry of Health have integrated sports and exercise medicine within public healthcare. But I think the challenge in Brunei is more about, and I'll say it again, I'm sorry, the Ministry of Education. We're dealing with a country here where in some schools, the PE is only half an hour. It's shrunk to half an hour. And we're trying our best here to educate people in policy or important people that it's harming our physical literacy, it's harming our children, not just for performance for future athletes, but their future health. So if there's an important message and a plea from me today is for anyone who knows anyone important in the Ministry of Education to hear us and for me to speak to them. Okay. Said it very gently. Okay. And lastly, the importance of working in an MDT setting. For those of us who have worked in elite sport, we know the importance the physiotherapists, the sports scientists, even the coaches bring towards an athlete's health. In a clinic setting, it's a challenge for me in Brunei to bring a physiotherapist, a podiatrist into my clinic and do an assessment together. But we know, for those of us who worked in elite sport, how much benefit I get, or you get, with a physio alongside to do this holistic assessment of an athlete. So I think that's not just here. In my time in UK, that was always a challenge as well. In Brunei, what's unique in Brunei? Say it's relatively new. We're still finding our feet in the public healthcare system. As I mentioned before, there is a lack of awareness of what sports and exercise medicine actually is. It's not just about sports injuries. We are especially lacking manpower, as Dr. Esam highlighted at the start. How many local sports and exercise medicine doctors do we have? But not only doctors, it's also across the healthcare professionals. For example, physiotherapists. How many do we have with higher qualification in sports medicine? How many do we have with the experience working in real elite teams? A local training program, and luckily we do have this agreement with Singapore at the moment. And some would say that this is a challenge, and some would say it's not, but perhaps the standard of elite sport in Brunei. Some would say in elite sport it's more about marginal gains, and we need to focus our energy on other things. How much benefit would an athlete actually get if they're not even near the medals? Okay, so these are the challenges and the perception that we will have to challenge in the public, okay, to really push sports medicine. Because we do have talented athletes, okay, we do. And it's important that they do get access to sports, first-class sports medicine. Okay, almost the end, don't worry, a few more minutes. The future, and this is a very important slide, okay? This is not an announcement, don't worry, okay? But it's a notice of intention that it makes, that this will be coming. The intention to create a national sports and exercise medicine center in Brunei, where everything is centralized and all our resources are pooled together. It's a small country. And we hope to have access to world-class facilities and increase resources through a private hospital in Brunei. So that's in the future. All right. This is not an announcement again, okay? But every country is moving or has already moved to create a National Institute of Sport. A lot of countries have identified an Institute of Sport as key to the success, their medal success. We are trying to move towards this, okay? But, so we are trying to move towards this, okay? And it's not an announcement, but internally we are moving towards this, okay? But there are various challenges to doing so, okay? And Dr. Esam actually wanted me to talk about the challenges. Yeah, I think creating something new is always quite difficult. And if you look in history, the Australian Institute of Sport took about 4 to 5 years, okay? And we've started this journey, and we need to be realistic that a big venture like this takes time. Something new, okay? In Brunei is very unique. I think Bruneians will relate to this. Maybe the foreigners will need to come and speak to me. There's always this risk and reward balance in Brunei about creating something new. A very important thing here is, as locals or Bruneians, we need to be convinced that this is absolutely the right thing for our country. One man cannot do this on his own. It's impossible. We need a collective effort. We all need to be educated. And I'm very thankful for today that we can raise awareness about the importance of sports and exercise medicine. We all need to be convinced as Bruneians that this is the right thing for our country, okay? Because it really depends on your help from the top to the bottom to have this vision aligned that this is absolutely the right thing for our country. A real challenge is setting up an institute without real specialized.
Final minute.
I'll be done in 2. Real specialized people. Okay. Now, if you are out there and you have experience, come and see me. Okay. We are looking for people like you who have trained and are looking for a job, or who have experience. Come and find me. People who are wanting to go and pursue this career, come and find me. There are opportunities. People who are abroad and want to help, who are keen to help set up something, come and find me. Or if you know people, do put us in touch. Okay. And the last one is creating and developing exercise medicine in Brunei. Many of you will know this. Exercise medicine is an American College of Sports and Sports Medicine initiative. Various countries have it. And creating something in Brunei is always something that we've wanted to do. Yes, we can do this as a department or a national center, but it makes sense to do it under the umbrella where we can have their support and use proven tool. Okay? So, in summary, I want to end with this. Okay? Sports and exercise medicine in Brunei actually not so new. It started in 1989. Okay? So it's not too bad. Athletes have benefited over the years. However, things have moved on very rapidly, okay? It's unlike any industry. The sports industry is fueled by results. And as a result, you will find sports medicine accelerates at a pace. It's funded purely by elite sports. It moves on. And there is a need for us to continuously evolve. We need to continuously raise awareness of the importance of sports and exercise medicine. We really need more specialists and experienced people in the field in Brunei. And there are plenty of new developments to look forward to for the future in Brunei. So we really hope for your support. Thank you very much for your time. Please come and find me. Please come and find me after the talk if you're keen on getting involved. And we hope to have your support for the future ventures for the years to come. Thank you very much.
Thank you, Dr. Adrian. That was a good insight into sports and exercise medicine in Brunei. Are there any questions, queries? I'm sure you can find Dr. Adrian going here and there, and he keeps asking, you can come see me, so you can definitely go see him. But if you have any questions before we head out for lunch, this would be the time to ask him.
Thank you, Dr. Adrian Lim. I'm not a doctor because medical schools rejected me. My name is Robin Chow. Okay. Now, coming to challenges, I was wondering whether Dr. Lim, would there be a challenge? One of these things would be a challenge. I got 3 questions, by the way. Either I ask all 3 one go or one by one. Now, are you or MOH doctors restricted from prescribing any sort of therapy or medicine unless it's been authorized by, let's say, WHO or by Big Pharma? So, because basically the reason why I ask this question is because I see that with the advent of the internet, with the advent of Google and YouTube, there is a lot of things that we see, which is theoretically healthy. But when I ask the doctors whether they will prescribe it, and the answer is no, they cannot. And it seems that whatever Big Pharma do not teach you with your health, you cannot prescribe. And it seems also to do with the WHO. So I want to inquire the reality of our autonomy, Brunei as a country, in prescribing the best for our population, or are we curtailed?
Okay, you don't mean in terms of a doping context, right?
No, in terms of doping, in terms of sugar, for example, versus as opposed to glucose. We need glucose. Sugar contains fructose, which is a toxin.
At the moment, no, we are not restricted from prescribing any drug. At the moment, the Ministry of Health has allowed us to use the best available drug for any musculoskeletal condition that we deem worthy to use. Okay? And I know in many countries, like in the UK, we were pressured by cost effectiveness. In Brunei, we don't have such pressure just yet. So we are allowed, and every drug in the Ripas Hospital is available for us to prescribe.
Thank you. I beg to differ from what I understand. We move on. The Ministry of Education, I said I beg to differ, but we move on. Ministry of Education, you mentioned that physical exercises, I suppose Ministry of Health's curriculum for students in school. Other than physical exercise, would the Ministry of Health be giving a curriculum wider than the need of half an hour's exercise once a week, let's say? Because I believe PE, exercise being one of the subjects, it should be just a seed of a person to be exercising throughout more than what's allowed in school. So I don't believe that just half an hour is not enough or whatever. But the thing is this, I find really lacking in the curriculum given by Ministry of Health to Ministry of Education in promoting health. For example, exercise burns a bit of calories, strengthens the muscles a bit, but obesity, I don't think exercise can bring down obesity. I suppose the education curriculum will need to have wider aspect than just physical exercise.
Okay, I understand. Just with regards to obesity, the obesity clinic that we work with doesn't just deal with exercise, it deals through an MDT approach. So alongside exercise, they are being prescribed medication to lose weight. They're also seeing a psychologist to help change their mindset and their lifestyle modification behavior. And they also see a dietitian and nutritionist at the same time. So it's an MDT approach. With regards to Ministry of Education, I need to be fair to my colleagues. Looking through, there is a department, okay, dealing with PE. And I have seen the curriculum for PE, and it's good, okay, 1.5 hours, 2 hours. And I need to be, and I want to say this politely, okay. The issue is not so much with Jabatan co-curriculum. It's not. The issue is not with the department who comes up with the PE. Okay? It's more about the policymakers and fitting it into the whole vision of what Ministry of Education want to do. And for us, elsewhere, it seems the priority is just academics, when actually they need to look at it from a wider point of view. Okay? Yes.
Due to us running over time, that was the end of Q&A. Thank you for your expertise, Dr. Adrian, to Brunei Sports and...
Hold on, this one. Just to continue. Ministry of Health have put on the recommended number of hours per week for exercise. How Ministry of Education will apply, this is up to Ministry of Education. So actually the guidebook have 150 of moderate or 75 of vigorous or moderate exercise a week or for the students. How do you do it? That is up to Ministry of Education.
Thank you for your expertise, Dr. Adrian, to Brunei Sports Science and Medicine. Can we please ask Dr. Isham Shaban present the appreciation certificate? Please welcome Dr. Isham and Dr. Adrian.
Sports medicine, yes. Yes, sports and exercise medicine, yes.
That was the last speaker for this morning. As we all descend, I'd like to invite our distinguished guests to move to lunchroom level 4 for their refreshment. And to our participants, wishing all a great lunch and drive safe when commuting back and forth. We will commence our afternoon session at 1:30 p.m. Hope to see all participants back here slightly earlier for a smooth continuation of today's Sports Science and Medicine Conference. One of you in Brunei. Lastly, thank you. Wabillahi taufiq wal hidayah. Assalamualaikum warahmatullahi wabarakatuh.
So do you work with the government or do you do the private?
No, I 70 years.
Oh, so you're not practicing? Oh, okay. You don't look 70. You're really fit.
I cannot walk. I cannot speak.
Thank you.
Thank you, boss. Thank you so
very
much
interesting.
for hosting us.
You're welcome.